As bodybuilders, our main goal is to put on muscle mass, to have more contractile tissue, to get stronger inside the gym, but we forget often about our tendons and our joints. I really hope that you're not injured, and this is not the reason you're watching this video. I hope that you're watching this video as a form of prevention. Now, the muscle is a highly vascularized tissue. It's a soft tissue that helps us move around. We lift weights and so on. And on the other side, we have the tendons that are made out of collagen. They are connective tissues between muscle and bone. They are much less vascularized and unfortunately way harder to heal. We as bodybuilders, we often forget about the tendons, forget about the joints. We don't really emphasize on them. We don't take care of them, unfortunately. We may have knee pains, which are very often, shoulder pains, elbow pains, and so on. Let's see a little bit more in depth the difference between a muscle and a tendon. In order to grow our muscle mass, our muscle tissue, what we do inside the gym, we go and we lift weights heavier and heavier, and we push that muscle to fatigue, to failure, and this way we break down, we do these micro tears inside the muscle tissue. What the body does, it secretes the hormones, testosterone, growth hormone, IGF-1, and these hormones help rebuild that muscle mass. This process is called muscle protein synthesis. If throughout the year we repeat doing this process, we have a proper nutrition, higher in protein, the body will repair that muscle tissue and we will grow bigger and stronger. Now on the flip side, for the tendons, it's called the collagen synthesis. So what we have to do is we have to put the same stress on the tendons, so the body will secrete again the same hormones like growth hormone and IGF-1, and it will repair that tendon. So what will happen, it will be again inside the tendon some micro tears, and the body will repair the tendon, make it bigger and stronger. Now we need to see how we can impose those micro tears inside the tendon, because we work out with weights, but it's not the same thing when we target the muscle and when we target the tendons. In order to put stress on the tendons, we need to focus on two major things: isometrics and slow eccentrics. When we are talking about isometrics, what I want you to do is to use a weight that allows you to do maximum 5 repetitions normally. Use that weight and keep it for 45 seconds. I give you an example. Let's say that you can do a hack squat with 100 kilograms for 5 reps. I want you to take that 100 kilograms and to maintain lower into a squat for 45 seconds. This way, what will happen, the quad will start to contract more and more and more, and it will pull the patellar tendon. And like this, you will have some micro tears inside the tendon, and the body will secrete the hormones and the collagen synthesis process will start to occur. If you're a healthy person, I hope you are, and you're not watching this video because you're injured, how you can prevent this type of injuries is to introduce into your workouts one exercise that has this type of iso holds, so you can do 4 sets of 45 seconds of heavy iso holds. You can do this for your knees, you can do this for your shoulders, for your elbows, also for your Achilles tendon, and you will prevent future injuries. Your joints will be much stronger. Now the second point was eccentrics. We have to control the negative part of the movement. I always preach about this. We never want to just drop the weight. The muscle is 50% stronger on the eccentric part, so we need to take advantage of this. So I want you to use one exercise that will be focused more on the tendon and go 3 seconds on the way down, but clear 3 seconds. Count it: 3, 2, 1, and then 1 second up again. So you focus on this type of movements. This way the tendon will be stressed also, and the collagen synthesis will take place again. Now on the other exercise, again, focus on eccentrics. Don't take 3 seconds, go 2 seconds, but never drop too fast. Take advantage of the eccentric. So if you're healthy and you want to prevent the injury and you want to strengthen your joints, 2 points, 2 big points: isometric, introduce one exercise per muscle group of isometric, and for every other exercise, slow eccentric. Now on the flip side, if you're injured, which is my case for my elbow, my tendon, I can insert right here my MRI. As you can see, my tendon is not straight, it's in an S shape. What I need to do is to pull that tendon, strengthen it again. And what I'm doing, unfortunately, is very boring, but every 48 hours I have the same workout, which consists of 16 sets of iso holds. Every set is 45 seconds, and I start lighter, so I never go very heavy. I have to have a pain 4 or 5 out of 10 during the exercise, and that pain has to be for 24 hours. So if you're injured, this is why I recommend you do this type of workouts, iso holds, to have that pain. So start lighter and then slowly increase the weight. Make sure you don't push that pain above 5, so keep it 4 or 5 out of 10. And after 24 hours, the pain should decrease. So when you reach again the 48-hour mark, you have to do the same thing again. Obviously, what I will do, I will slowly push with every workout, slightly increase the weight, 1 kilogram, 2 kilograms per workout, to push a little bit the tendon more, to make sure that I put enough stress on the tendon. And this is how I eventually progress, and I will move to slow eccentrics. For now, it's just isometric movement. If you have any type of injuries, elbow, shoulders, knees, make sure that you go to the doctor, do an MRI if it's necessary, make sure that there's not a tear in there. If it's just a micro tear or some type of discomfort in that joint that causes this pain, make sure you do also physiotherapy and ask your physiotherapist what you should do. He will probably advise you to do isometric movements. Then I suggest you to start doing this type of workouts. The main reason I did this video is for you guys to prevent this type of injuries. They are really nasty injuries, and for me it's been 6 months since I had a proper upper body workout. Unfortunately, it's very boring, it hurts, it prevents me from doing what I truly love. At least I can do legs 100%. So yeah, guys, thanks again for watching. Stay safe, prevent some injuries, and see you next time. Thanks. Ciao.